Nearly 1 year into the COVID-19 pandemic, we're looking at the toll it's taken on our healthcare workers.
Right now, these are some of the hardest days I've had.
This is unlike any other thing we've seen in the past.
It's a devastating, awful virus.
Amid all the anxiety and pain is also a lot of hope now that so many Coloradans' healthcare workers are getting vaccinated.
I feel more confident every time I walk into a patient's room. I feel more confident when I go to the grocery store.
We're dedicating our next half hour to Colorado's healthcare workers who have not wavered in the face of a global pandemic.
We don't feel like heroes. It's our job.
Our tribute to healthcare heroes starts now. So much has been asked of and delivered by these healthcare heroes, so today we're taking some time to look back, remember, and honor the service of Colorado's healthcare workers since the start of this pandemic.
And their service is far from over as people are still getting sick and dying from COVID-19 every day. But the reason we've made it this far to this point, it's due to the hard work of Colorado's 76,000 healthcare workers. One of them, an ICU nurse in Greeley. She spoke to us in November when hospitals statewide started seeing surges in the virus in patients, and she told us she was terrified of a staffing shortage. As she told our Katie Eastman, this pandemic is like nothing she's seen before.
On the outside of North Colorado Medical Center, the signs thanking heroes are a reminder that what happened in the spring is happening again. This time, it's worse.
We talk about it too, about how we don't feel like heroes. It's our job.
Inside, Jen Lingle works as a critical care nurse.
Well, I'll probably cry. I'm just going to warn you now.
On Tuesday, she's in charge of the ICU, the COVID ICU, and the burn unit. Over the weekend, her hospital began putting 2 COVID-19 patients in every room and assigned 3 ICU patients to every nurse. In her 10 years here, that's never happened.
So you are spread thinner to take care of 3 very sick patients, and that is really what wears these nurses out. So we are now past the high point from our spring surge, which is terrifying to us.
The surge in the spring gave them practice. That doesn't make it any easier now.
Just that process of when a patient is spiraling downhill and you have to help them be on the phone with their families to say goodbye. It takes a piece of you.
Jen wishes you could see what she does to understand how much people are hurting. Understand that when she leaves this interview, she'll give another piece of herself.
I'm going to go back to work and I'm going to go finding beds for these COVID patients that are currently coming in. And I'm going to support my team and in any way that I can. And we're going to get through another day and we'll do it again tomorrow.
Again tomorrow. And the next day after that, too.
Yeah, it was hard because I'm not supposed to work Thanksgiving. And I called all my family and I said, hey, just let you know, I think the need is going to be greater here.
The holiday will come next year for Jen and her family. She can't say the same for all her patients.
We want to let the community know that they're not alone. We never leave them.
In Greeley, Katie Eastman, 9 News.
That story first aired in November. According to the most recent CDPHE data, 12% of hospitals in Colorado are in danger of staff shortages within the next week, and 8% could see shortages of ICU beds.
And so much has changed just over the last year in such a small amount of time. 9 months ago, last April, COVID-19 numbers were continuing to climb in Colorado. We were so unsure as to how we would deal with it. Well, at that time, we spent a day with 3 nurses in Colorado working through the still new struggles of treating a deadly virus. We talked about the sacrifices they were making and somehow the way that they kept showing up to work with a positive attitude.
Right now, these are some of the hardest days I've had. And I feel that I can't go home and I can't hold my daughter without possibly putting her at risk.
It's been hard. Like, there's definitely some days I cry a lot.
I've had to self-isolate from my family to a certain degree.
I can tell my sleep's affected, and I've never really felt like I'm a super anxious person. And I feel like I'm much more anxious than I was.
I really think, when this is all said and done, I'm going to be a better nurse for it.
For me,
those nurses and doctors have continued to show up at work for months now, despite the risk to their own health. Over the last year, thousands of healthcare workers have become sick with COVID-19, and unfortunately, not all recovered. The Guardian and KHN are investigating the deaths of healthcare workers in the United States, and they report more than 3,200 healthcare workers have died of COVID-19 nationwide. 26 of those deaths were here in Colorado. It is a tragedy, and more healthcare workers remain at risk the longer the pandemic drags on. However, we do now have that way out, that shot at saving lives.
Provide some hope there. Not one, but two COVID-19 vaccines. Colorado has put healthcare workers first in line for those shots. Of the more than 80,000 people in Colorado who have received both doses of the vaccine, more than 64,000 of them healthcare workers. That's 85% of Colorado's healthcare workers now fully vaccinated. Our 9 Health expert, Dr. Pyle Coley, is one of them. She wants to stress healthcare workers are not finished fighting on the front lines of this pandemic. They're just making sure they are all fully vaccinated, and that is an incredible first step.
It feels like such an incredible relief. I literally feel like a weight has been lifted off my chest. First for myself, because every time I went into the ICU or went into a rule out COVID room, you know, you're covered head to toe, but there's still always a possibility that something could get in. So you always worry a little bit about yourself. But second, it's for my colleagues. You know, I feel like I've fought a war and I've had all these fallen comrades, and so many people that I know have, you know, gotten COVID. Thankfully, most of them have recovered because they're young and otherwise healthy. But we have lost some really valuable, really, you know, prominent people in medicine, leaders and such in medicine that we looked up to. And that has been a tragic loss for us. And so it just feels like a sense of relief, almost like it's not just the cavalry that's here, but it's our extra armor now.
Those stories of those ER doctors and nurses that we heard over the time, they were devastating to think what they were doing, and then they got sick and died.
Well, nowadays, it doesn't matter your age, our attention span has shrunk to near nothing, but it's been less than a year for most people to have dealt with COVID, but it is something that you need to continue to reflect back on and see where we are, where we were, what we've learned, and how we've changed, because we have all changed.
So many ways. Hopefully the best.
Still to come, doctors and nurses not the only ones working overtime to save lives. We're going to meet some of the other healthcare heroes.
We're also going to return to the story of one of Colorado's sickest COVID patients and the extra lengths doctors went to save her life.
And we're asking you to share your support for our healthcare workers on our 9 News Facebook page. We've already got dozens of comments and shout outs, and we'll be sharing a few of those coming up next at 4 o'clock. Well, before the pandemic, you may have never heard of a respiratory therapist. Well, now they hold one of the most important jobs in a hospital as far as fighting a respiratory virus. They see all aspects of COVID-19, from the ICU to the emergency room.
Respiratory therapy, I mean, anything to do with breathing, we're there. We assist with putting in artificial airways. We run the mechanical ventilators.
They see.
It was back in April that we spoke with a pair of respiratory therapists. Joaquin works at Littleton Adventist Hospital, and his fiancée Nicole is an RT at Parker Adventist. They never thought their skills would be so needed.
The other thing we've seen in the past.
It's a devastating, awful virus.
Well, this couple was originally set to be married at the end of April, but instead they canceled their wedding and worked long hours instead, treating COVID-19 patients. We are seeing sacrifices from frontline workers of all kinds. Mark Salinger recently introduced us to some of the healthcare heroes that you might not think about.
Inside these walls, a battle to fight the pandemic rages every day. Fought by an army of doctors, nurses, and staff members who work behind the scenes to keep the hospital running.
I enjoy people in general. I like talking to people. I like getting to know people.
Maria Saavedra is a food service technician at UC Health. Without her and her team, patients wouldn't eat. She delivers the food made in the kitchen to hundreds of patients in their rooms every day.
I think towards the beginning, some people were scared to come to work. I was here every day.
Maria started her job just before the pandemic. When the virus began to spread, she sent her son away to live with his grandparents while she worked double shifts at the hospital.
He went to stay with them just because we all knew it was going to be tricky being in a hospital, and we didn't know if I was going to get sick, and I didn't want to get him sick.
Crazy sometimes. Bennett Lewis is just 20 years old, taking public transportation home every day after cleaning operating rooms at the hospital. He's part of a school-to-work transition program called Project Search. Megan Quinn is his job coach.
When he first had to change over clean his first COVID room, Bennett wasn't scared or anything. He came home and he bragged about it.
For the entirety of the pandemic, Bennett has donned his PPE and charged onto the front lines of fighting the virus.
Yes, I do.
Just one of countless healthcare workers fighting the virus behind the scenes.
My hope would be for our numbers to go down and for us to be able to live a more normal life.
All working to treat the sick and keep the rest of us healthy. In Denver, I'm Mark Salinger, 9 News.
Thank you, Mark. A great reminder that all of the healthcare heroes do deserve our support. Denver's pro sports teams have shown their support with the help of UC Health.
Typically when you come out and you see something on your car, all you're thinking is, great, someone left another flyer on my car, another piece of trash I'm going to have to throw away. So when you see it's actually someone saying thank you for everything you do, it's pretty nice to have that.
Sam Stockton has been helping to feed the doctors, nurses, hospital workers, and patients at UC Health's Highlands Ranch Hospital. But a letter from the Nuggets was left on his car a few weeks ago thanking him for his work. Of course, you can write your own thank you note. Just visit the UC Health website. And we've asked you to send your support to our healthcare heroes. We've gotten dozens of responses on the 9 News Facebook page, some of them reading long lines of thank you for everything you do. Shout out to all my coworkers, and you are our real heroes.
We can't get enough of that. Looking live on Denver, where it isn't snowing just yet. Kathy's here with another look at the overnight forecast. And Kathy, we've certainly seen it out east.
Yep, no big surprises right in January. And we're actually grateful, aren't we, Kim, for the moisture that we're seeing. We're in between two storms, so one round of light snow off to the east, the next one with a storm coming in from the southwest. So let's take a look. It's cloudy and cold but dry in Denver with 30 degrees currently, and the wind chill is 22. The weather is very cold to the north, but we're just going to catch a piece of that cold Arctic air as it slides off to the east. A bit of mountain snow overnight as that second system winds into central Colorado, where avalanche advisories have been posted, and also winter weather advisories that go out from Colorado Springs to Pueblo and out across extreme eastern Colorado. In the Denver metro area, you know, we're looking, as we're seeing this moisture in between these two storms, keep that cloud cover intact. But I do believe the snow that will fall tonight will be light, about a half an inch or so with a low of 18. Tomorrow, another half an inch with a high of only 27. Then clearing. We drop to 11, and then we get into a nice warming trend that starts Wednesday and lasts to Friday. Kim, Tom will be close to 60 by the end of the week.
Oh, thanks, Kathy. Coming up, it's a story that too many families know too well. It is one of the sickest Colorado patients of COVID-19 and what the families deal with.
Mom is not going to be a statistic. She's going to be a story.
We're also hearing from her doctors on how they managed to save Barbara's life. Frontline correspondent. Have to be a frontline mental health correspondent. Oh, it's KDVR.
She said, you need to understand, this is a Hail Mary. This is all we got left. This is a Hail Mary. It may or may not work, but we're going to give it a try.
A Hail Mary. One last chance. That's what doctors gave to Barbara Gold. Barbara is from Boulder. When she got sick with COVID-19, she got very sick. She spent weeks on a ventilator, and then doctors agreed to try something they weren't sure would work.
And Dr. Rove kind of listened, and we had the conversation, and she said, I'm going to go advocate for you.
I could almost like hear Alan kind of like trying to think about all those different things. And I said, you know what? It's okay, I get it. Like I got his relationship with her and what she would want, and she wanted a chance. He wanted a chance, and so we just did it.
Barbara was airlifted to UC Health, where she was given ECMO treatments. ECMO is a machine that takes over for the heart and lungs and kind of gives them a chance to heal. At first, Barbara did not get better, and then she slowly started to improve. Barbara was able to come off the ventilator after 65 days, and now she is a COVID survivor.
Her case has really been the inspiration for some of the research that we're doing now. in looking at the recovery of patients after ECMO and not just their survival.
Mom is not going to be a statistic. She's going to be a story. And here we are.
That's what her son said. From the hospital to rehab, Barbara spent 91 days recovering from COVID-19. She is home with her family, and they all credit the healthcare heroes for saving her life. And part of what we talked about in that story, Tom, was the communication. Her family, great support to her, but they're communicating to doctors and nurses they can't see. They're doing it over Zoom and FaceTime and trying to talk about what the choices are and what they can do.
Well, you think of the toughness of the patient, Barbara, of course, the tenacity of the family, and the creativity of the doctor and the medical community willing to try those ECMO treatments and finding a way to make it all work. It took everyone working together. They did, and that made it a great story. Like they said, she was going to be a story, and she
Barbara
is.
was something. She just texted me recently.
Well,
during this newscast.
Tell her hello.
She's doing great. She's, she's off of oxygen most of the time. She's walking, but she's working hard with a lot of great healthcare workers she talks about all the time. All the therapists, nurses, doctors, everybody that worked.
I'm sure. Well, it is difficult to describe what healthcare workers have endured over these last few months, but one nurse is doing just that in song.
From what I see, we're breaking.
We're going to share her story and where she is now. That's next at 4.
So just think of what our ICU nurses have seen over the last year of this pandemic, what they've dealt with and how hard they've worked, and really the sadness too.
So Emily Wertham wants to help you understand. She works in the ICU at UC Health in Highlands Ranch, and last month she told us her story in her voice.
I've loved music all my life. Music has gotten me through all of the hardest parts of my life. It's really important to me.
We had a date today
trudging through the waters, trying to keep our heads above. My name's Emily Wertham. I am an ICU nurse at Highlands Ranch Hospital. We've been giving it our all. I definitely think working during COVID, I've been more stressed than I've ever been. From what I see, we're breaking and no one is listening. We're battling a giant and we're losing. For this whole pandemic, I've had a lot of difficulty putting into words how I really feel about what's going on. So I took a lot of those ideas and kind of just put it all into this song that I wrote. They are scared today. We try to hold them up, but there's not enough of us to ease the pain. It's a pretty sad theme to the song, but we do see a lot of families that aren't able to say goodbye to each other, aren't able to see each other. We see, nurses that are working so hard to get to everyone and comfort everyone, but there's so much to get accomplished and so many people to see that it's challenging. Try to save all the lives we touch, but it's not enough. We're not enough. Some people that have heard it have told me that it's exactly what they've been thinking in their heads but haven't been able to say. And I want us to all be able to kind of be united in those same thoughts and realize we're all going through it together. Barely keeping our heads above the waves.
That was Emily's song through the lens of our photojournalist Corky Scholl. Now, Emily says she wrote that entire song in one day, which is record time for her. But when Emily's story aired last month on Next, the team organizing President Biden's inauguration, well, they saw the celebration organizers saw it, loved her voice, and asked her to be part of the event. So she was featured singing along with Demi Lovato and other healthcare workers from all around the country. A nice treat for her, and nice to see her getting some of the recognition that she and so many richly deserve.
Yeah, we just hope that recognition continues. I mean, we've seen it through all kinds of interesting things, and I know the Super Bowl, many of them are going to be able to attend. I mean, we just can't say enough to our healthcare workers.
Well, and that's the thing. I think one of the things we've seen is the ups and downs of the pandemic, that many people have started to see the end prematurely and realizing we are still in the midst of this. And that means the healthcare heroes that we're paying tribute today are in the midst of it as well. There is still a long way to go, and hopefully we will continue to hold them high and think of them as often as we can. We appreciate you watching our special tribute to healthcare heroes. 9 News at 5 is next.